How are you? So one of the biggest complaints that I hear a lot of, and one of the number one reasons why women are avoiding the deadlift is because of lower back pain. They're experiencing some pain back here, they feel like they need to give up whether heavy lifting, they feel like they need to give up lifts altogether because they don't want to make the pain in their lower back worse. And so one fix I tend to use is a core engagement. So depending on how you're engaging your core, may impact how your lower back is being supported. So first, what I commonly run across is the belly button to spine cue. Not a bad cue. It works for a lot of people, but for some, what happens is when they try to connect their belly button to spine, most of the work is coming from the top part of the abs, right? So if you think belly button to spine, a lot of the work is coming just from within the rib cage or just underneath the rib cage. Not bad. However, if you think about it, if all of the work is coming from up here, there isn't a lot of support for your lower back down here. So what we want to do is we want to try and get the core working as a whole. So we want the bottom part, so the TVA, transverse abs, the rectus muscles. We also want muscles in the lower back working, as well as in the pelvic floor and diaphragm. Okay, so one way we do this is you can do this laying down, seated or standing, but what we want to do is add in a pelvic floor contraction or contraction of the vaginal muscles or Kegel in with how we engage our core. So first thing I teach is to inhale through your nose and exhale through your mouth. Okay? Inhale, exhale out like you're blowing through a straw. Keep in mind, you want to get all the air out. So big deep breath in, all the air comes out. Okay, so next what we want to do, inhale, exhale, and we want to pull our hip bones into our belly button. This will make this will make the TVA work pretty hard, right? So inhale, exhale, and pulling your hip bones into your belly button. Okay, now the next layer I add in, got your inhale, your exhale, pulling your hip bone into your belly button and lifting your vagina up and in. So imagine it like an elevator. It's not like a big squeeze all at once. It's just a lift from going from the basement to, I guess, floor 3 or 4. So let's try this again. Inhale, exhale, pull those hip bones in, the vaginal muscles come up and in, and as you can see, the lower back muscles are now also turning on, so they are also working with this core engagement. So if you're going to lift really heavy, this is a good one to go with. Or if you're going to lift really light, maybe this is a good one to go with as well. So just remember, if belly button to spine isn't working for you, if you're finding that all of the ab work or your ab is working hard up here, but not so much down here, give the cue or give the strategy that I just taught you a try and let me know how it goes.